The UCLA Center for Health Policy Research is committed to producing high-quality, comprehensive data and putting it into the hands of the public in ways that inform, educate, and result in grassroots-driven policy change. UCLA CHPR is home to the California Health Interview Survey, also known as CHIS, the nation's largest state health survey and a critical source of data on California's diverse population, including rich data sets across racial and ethnic groups. Since the COVID-19 outbreak illuminated alarming health disparities across racial and ethnic groups, UCLA CHPR has created a dashboard to address the vital need for data that covers racial and ethnic groups, especially groups who have been disproportionately impacted by the disease. The dashboard aims to help public health researchers, advocates, media representatives, and other individuals in supporting reports or other analyses looking at California county-specific racial and ethnic disparities and other health factors such as the presence of chronic or underlying health conditions. To access the dashboard from the main UCLA CHPR page, click on the Health Profiles tab. From that page, click on the COVID-19 dashboard link, and that will take you to our COVID-19 dashboard. The dashboard is presented in 3 different sections: COVID-19 Numbers and Rates section, Health and Sociodemographic Indicators section, and Data Sources and Methodology section. In the COVID-19 Numbers and Rates section, you will see a map of the state of California that provides information on total cases and deaths by California counties. You may filter the map by different COVID-19 data points to change the color gradient of this map. Hovering over a county will display a tooltip that provides total number of cases, cases by 100,000, total number of deaths, and deaths by 100,000. Information on the data source and when the data was updated is included. For those counties that provide race and ethnicity data, there will also be a bar graph in the tooltip that includes the cases and deaths per 100,000 by race and ethnicity. Information on the data source and when that data was updated is also included. On the right-hand side of this section are the COVID-19 graphs by race and ethnicity. These graphs provide information on different COVID-19 data points. You may filter the graph from a drop-down menu. Hovering over a bar on the graph will display a tooltip that provides the geography name, race and ethnic group, COVID-19 data point that is selected, and information on the data source and when the data was last updated. Clicking on a county on the map will filter the county graph to only show race and ethnicity data for that county that was selected. If a county does not have any race ethnicity data, then a message appears informing the user that that specific county does not report data. We will now look at the Health and Sociodemographic Indicators section. There is a state map of California, and it has the exact same functionality as the map in the COVID-19 Numbers and Rates section. On the right-hand side is the Health and Sociodemographic Indicators graph. This provides information on the different health and sociodemographic indicators by race and ethnicity linked to COVID-19. Users can filter the graph from a drop-down menu. Hovering over a bar on the graph will display a tooltip that provides the geography name, thorough description of the indicator selected, race and ethnicity group, indicator estimate, and data source information. Clicking on a county in the map will filter the graph by the county that was selected. The Data Sources and Methodology section provides detailed information on the data sources and their links. Alongside this are methods used to calculate the rates, alongside the source data used for the rate denominator. The California map provides links to each of the different county health department web pages that data was collected from to present the race and ethnicity data. The UCLA Center for Health Policy Research is dedicated to updating this dashboard to help further research on the COVID-19 pandemic and end racial and socioeconomic disparities. Please visit our website at healthpolicy.ucla.edu and subscribe to our emails by emailing healthpolicy@ucla.edu. Thank you.